A very warm welcome, everyone. I, Dr. Nishant Sharma, on behalf of Voice of Healthcare, thank you all for joining us today as we pay tribute to the exceptional healthcare professionals who've been tirelessly looking after our well-being day and night. Voice of Healthcare, along with our supporting partners, Yashoda Hospital, has taken this initiative to recognize National Doctors Day through our video series, Know Your Doctor. This series aims to showcase the diversified interests and passions of our esteemed doctors. On this National Doctors Day, let us express our gratitude towards these extraordinary individuals. So, to begin with the introduction, I introduce Dr. Sarita Sanke, consultant cosmetology and aesthetics at Yashoda Hospital. I wish you a very happy Doctors Day, ma'am. Welcome on the broadcast.
Thank you so much. Thank you, Dr. Nishant. It's
Yes.
a privilege to be present on this platform.
Thank you, ma'am. Thank you. It's a very similar privilege for me as well. So to start with the questions, I hope you're ready. Are you ready with the answers? So the first question,
Sure.
do you have any interesting stories or experiences from your medical career that have deeply influenced your perspective on everyday life as well as the practice of medicine that you do in your general life?
Okay. So, Dr. Nishant, as you know, I'm a dermatologist and a cosmetologist. So, if I recall, I had this one patient, a female. She was around 21 years, and she was from a very poor family, poor background. And she had come with her mother once to me. And the problem she was suffering was with a vitiligo patch. So, if you know, vitiligo is a white patch, commonly known as leukoderma. So she had a white patch on her face right here below the lip. Now, since she was from a poor background and she was staying, in the suburban areas, and she was not very well versed with all the treatments. So the mother was very depressed that she wanted to get her daughter married, as you know, like every mother's concern. Okay, so they were very in a bad condition that please do whatever possible to just take out this white patch. We are ready to give you anything, and but they were not very from a financial good background or something like that. So it is a very simple case. We and for vitiligo, what we do in a stable case is a simple surgery, grafting. So I explained her all the process and all, and we went forward. But when it came to the charges, the financial part, they were not very from a good background, so they were financially not very ready to pay the entire amount. But considering the background of the patient, the emotional part of the patient, they were like, so they were from such a humble background and from a good family, and they were trying to, connect with me personally. So that made me, to treat the patient without considering any, the financial part. I told her we'll do the procedure. I'll do everything possible in the best way. We did a very small surgery, and that hardly took like 1 or 2 hours. And after a period of around 3 to 6 months, the pigmentation was back. Okay. So after seeing the patient, after seeing the mother so happy and so, they were so grateful to me. So this is something, it's a very simple case for me, not something like I have done a very big thing or some complicated case or something major. Very simple case, but the kind of connect we got, the kind of the respect that I received from this family, from the daughter, even now she's in touch with me and she keeps remembering me, like on all the occasions like Diwali, Holi, she remembers and she wishes me, it's like from inside she's happy and she's grateful. So this is something very simple, and it feels nice that yes, you are in some good position, you are able to help some people, and you are able to get the self confidence back in a particular patient, and she can now face the world with courage, without thinking of anything about her vitiligo patch or anything like that. So this is something like very minor incidents, but I remember that this was something around 4 5 years back that happened. But I still remember that day, I still remember those faces. Okay, so this is something like whenever even now some people come from a poor background or simple people, they are not well versed with the city life and all. So I make a point that at least give them some, appropriate treatment and make them happy. Okay, so this is one incident that I remember.
I think it's your empathy and the care that you shown to her, which has reflected 4 5 years to this date as well.
Yes,
Right.
yes. Something which has emotionally connected with me.
Right. Right. That was a lovely answer, obviously. So moving on to the next question, are there any mentor figures or role models that you've had along your career or your personal life that has had a very deep impact on your journey as a doctor?
So I have to mention a few mentors, but I would
Mm-hmm.
like to take like one name, that is he is my HOD and Professor Dr. Ramchandra sir. So Dr. Nishant, I'm basically from Bangalore, South Indian.
Okay. Okay.
So when I came to Delhi for my post graduation at Lady Harding Medical College,
Mm-hmm.
like being a South Indian, everyone has this fear. Acha, you're going to North, you're going to
Little bit of
Delhi, it's
stigma.
not very safe. How will you
Yes.
manage? This kind. But I was courageous. I came here,
Mm-hmm.
and my HOD or my mentor was Dr. Ramchandra sir, and he is in a very senior position. He is also the director of RML Hospital now. So, but he has taken so much care of all of us, the postgraduates, the senior residents that are there in the college. He never felt like we are from outside, and I always get this fatherly feeling when we see him,
Mm-hmm.
and the kind of education or the mentorship or the guidance that he has provided. I'm really grateful to him. And he is one of the reasons that I survived my post graduation senior residency in Delhi very, very happily. I mean, there was not a single day that I felt, okay, why did I come here all the way
Mm-hmm.
from Bangalore? Okay, so he is one person that I will remember all my life. So
I think
yes.
you're learning the caring and the empathy from your role models only. I think
Yes,
that's
definitely.
what has
He is
been.
the very, very humble person, very down to earth.
Mhm.
Definitely. Yes.
Right, ma'am. Lovely. So moving on to the third question, which will be more on a personal and a fraternity front. So on this
Mhm.
National Doctors Day, what is the kind of advice or a message that you'd like to give to your fellow fraternity, to your fellow doctors?
So I'm not some big person that I have to give message to all my colleagues. I'm sure everybody is in their own position doing a very good work. But yes, one point is we should all be very humble and stay to stick to the stick to our roots. Okay,
Mm-hmm.
so and never think about the monetary benefits or anything. Just connect with the patients, then definitely your patients will remember you always, and you will have a very good career in the future. Yeah.
Right. It's lovely to hear and have this refreshing conversation with you. So, with this, I would like to end the session, and I'd like to thank you and thank all the doctors around our nation who've been selflessly serving us. And together, we dedicate and we salute to your dedication, to your compassion, to the unwavering commitment of the taking care of our health. So, we thank you and wish you a very happy Doctors' Day, ma'am.
Thank you, Dr. Nishan. Thank you, everyone.